Vice Chancellor Bayero University Kano, Professor Muhammad Yahuza Bello, University Registrar, Comrade Haruna Aliyu, ably represented by the Director here, Madam Aminu Ulawa, the University Librarian, Dr. Kabiru Dahiru Abbas, the University Bossa, Madam Rabiu Dauda, former Vice Chancellor, Federal University Duse, and presently the Vice Chancellor, Azman University Kano, Professor Fatima Batul Mukhtar, former Provost FCE Kano, Professor Tijani Ismail, other visiting Vice Chancellors and Registrars here present, Chairman of the Professorial Inaugural Lecture Committee, Professor Ibrahim Sani, Provost, Deans, Head of Departments, members of the University Senate, members of the University Congregation, the inaugural lecture presenter, Professor Hassana Sani Darma, and her darling husband, Dr. Umar Farooq Usman, the Meungkwar Darma, and other members of the Darma family, Alhaji Mahmoud Sani Darma, distinguished invited guests, students, ladies and gentlemen, members of the press, well-wishers, and friends of the university, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. We gather here for the umpteenth time to listen to the 61st Professorial Inaugural Lecture to be presented by Professor Hassana Sani Darma, former Vice Chancellor, Khadija University, Majia in Jigawa State, with the topic Rejigging Cognitive, Behavioral, and Coordination Functions, Nutrient Supplementation for Neurodivergent Disorders. And without taking much of our time, I will invite the chairman of this occasion, who is the Vice Chancellor of this great university, Comrade Professor Haruna Musa Ebasai, ably represented by the Deputy Vice Chancellor, Research and Development, Professor Amina Mustafa, to welcome all of us.
Thank you. أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي ربنا زدنا علما. Assalamu alaikum wa rahmatullahi wa barakatuh. The former Vice Chancellor of Behavioural University, Kano, Professor Umar Bello, former Vice Chancellor of University of Duse and currently Vice Chancellor of Azman University, Professor Fatima Batul Mukhtar, the former Vice Chancellor of the immediate past Vice Chancellor of University of Duse is also here. The principal officers here present, the university librarian, the university boss, and the representative of the registrar. The former Vice Chancellor Research and Development, Professor Abdullahi Sulekano, and all professors, all head of departments, all directors and deans here present. Assalamu alaikum wa rahmatullahi wabarakatuh. On behalf of the Vice Chancellor of Bayero University, Kano, Professor Haruna Musa Efasai, who is presently on an official engagement, I want to welcome all of you to this important occasion. We all know that as the tradition of Bayero University for professors to have an inaugural lecture. Today we have our very own, and I'm sure you know why I'm saying our very own. Yes, our very own, I'm repeating, Professor Hassana Sani Darma and her husband. She is going to rejigging cognitive, behavioral, and coordination functions, nutrient supplementation for neurodivergent disorders. We're going to, because Professor Darma has done a lot of work as far as special education is concerned, so I want us to pay very attention to this important lecture. On the part of the university, the Bayero University Kano management will continue to support inaugural lectures. So we want to urge each and every professor here present who has not presented his or her inaugural lecture to please follow it and make sure that before the end of this year, as the BSc keep on iterating that before the end of this year, we should be counting our professional inaugural lectures in 3 digits, not 2 digits. Thank you once again. I wish us all successful.
Once more, can we put our hands together for our Vice Chancellor, heavily represented by DVC Research and Development, Professor Amina Mustafa. I will now invite the Dean of the Faculty of Education, Professor Abubakar Ibrahim Hassan, who is going to introduce the lecturer. Before he introduces the lecturer, I will invite the lecturer, Professor Hassana Sani Darma, to come to the podium.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. The Vice Chancellor, Bayero University, Kano, ably represented by Deputy Vice Chancellor, Research and Development, Professor Amina Mustafa, the former Vice Chancellor of Bayero University, Kano, Professor Muhammad Yahuza Bello, former Vice Chancellors of Federal University, Dose, Professor Fatima Batul, and University Librarian, University Bossa, Deans, Directors, Head of Department of various faculties, Department and Unit of the University, staff and students of Bayero University, families, friends, and well-wishers of inaugural lecturer, chairman and members of inaugural lecture committee, members of university press, invited guests, ladies and gentlemen, Assalamu alaikum. I feel deeply honored to stand before this gathering to read the citation of a very respected person in the faculty, who I usually call my mother in the faculty, who is today presenting the 61st inaugural lecture in Bayero University. Today's lecturer is a mother to me because of the long existing relationship between my family and the family of the inaugural lecturer. We shared walls between my grandfather's house and also the family house of the inaugural lecturer in Darma quarters here in Kano City. My late father is also a closest friend and also a childhood friend, the elder brother of the inaugural lecturer, who is sitting there, the Umwad Darma, Alhaji Mahmoud Sani Darma. Therefore, my relationship with the inaugural lecture is beyond the four walls of the faculty and the university. Mr. Chairman, sir, today's inaugural lecturer, Professor Hassana Sani Darma, was born in Darma Quarters, State Ward, Kano Municipal Council, Kano State in 1965. She attended NEA Primary School, Aroromi, Apapa, Lagos, between 1971 to 1976. After completing her primary education, she proceeds to Kabo Girls Boarding Primary School between 1976 to 1971. She attended St. Louis Secondary School, Bampai, between 1977 to 1982. She also she obtained her diploma from Kano State Polytechnic in Hotel and Catering Management, and also she had a Bachelor's of Arts education degree in English, Masters of Education in Special Education, and PhD in Special Education. The inaugural lecturer actually held many administrative responsibilities from the department, faculty, university, and outside the university. She is a member of the University Senate. She was a former chairman, BUK staff, primary school and model secondary school. She was a member crèche committee, which was inaugurated by the university. A former director, gender studies, former deputy director in DRIP, a former member of the committee of university budget, committee of sexual harassment policy committee, safeguarding policy committee, committee of examination misconduct and linkages, and committee of professorial inaugural lecture committee. She also served in committees outside the university folds of the some include federal government and also at the state level, while some were membership of religious and community association. Professor Hassana Darma was appointed head of department in 2015. As head of department, she established a departmental assessment and diagnosis unit where clients are brought from near and far communities for assessment, management, and advice. From 2011 to date, the unit has assessed, diagnosed, and managed over 400 clients with different special needs conditions. The conditions include learning disabilities, attention deficit, hyperactivity disorder, developmental disorders, autism spectrum disorders, behavioral disorders, those that are associated with hearing loss or decrease, cerebral palsy, speech disorders, and several others. The unit has recorded success rate in improvement of symptoms of between 30 to 80% in all cases managed. When she was a head of Department of Special Education, she was able to reverse the status of the department from interim status to full accreditation status during the 2016 accreditation exercise. Some of her major achievements are as follows. 1, establishing an assessment and diagnostic unit in the department, proposing and getting Senate approval to commence 2 new programs. These are BSc Special Education and Postgraduate Diploma in Special Education and Rehabilitation. She also proposed and get approval by the Senate of Bayero University to the addition of 3 new areas of specialization in the master's program, namely intellectual disabilities, emotional and behavioral disorders, and physical and health employment. She also introduced the celebration of International Disability Day, that is on the 3rd December, that is the dividend of which radio programs presentation in 2015 and 2026 were conducted, and various lectures were also conducted in respect to that. In 2017, she succeeded in convincing the management of Behavioural University under the leadership of the then Vice Chancellor, Professor Muhammad Yahuza Bello, in the following areas: getting automatic hostel accommodation in the ground floor for students with special needs, reducing jam cut point to make admission more accessible to persons with special needs, setting up special need library to cater for the need of persons with special needs. And she also facilitated employment of 3 staff members to manage special needs in the library session. She was also appointed as Deputy Director Innovation, Directorate of Research, Innovation and Partnership in 2019, Director Center for Gender Studies 2020, and Pioneer Vice Chancellor of Khadija Majia University, Jigawa State in 2021. Professor Hassana Darma was the first professor in learning and first female professor in learning and behavioral disorder, first female professor in special education in the northern Nigeria, and the first female professor in private universities in northern Nigeria. Her scholarly activities include both within and outside Nigeria. She conducted several M.Ed and PhD external examination and assessed several promotional submissions to the rank of associate professors and professors. Professor Hassana Darma is also a consulting editor of 4 journals, namely Jigawa Journal of Education, Jigawa College of Education, Gumel, Jigawa State, Journal of Adult and Special Education, Federal College of Education, Technical Bichi, Behavioural Journal of Education, Research and Innovation, School of Continuing Education, and she is also a chief editor, Journal for Educational Research in Developing Areas, and International Online Journal. Professor Darma has more than 45 publications in reputable and local international journals. She also participated and presented several local and international workshops and conferences in areas of information technology, special needs education, counseling, and psychology. Assessment of strategies and procedures in research proposal writing, research grant management, strategic planning, education for sustainable development, gender and social inclusion, mental health, and so on and so forth. Part of our community services include Professor Hassana Darma is an advocate of peace and human development. She belongs to several non-governmental organizations and such as Federation of Muslim Women Association of Nigeria, Form 1, Muslim Rights Concern Murik, Family Advancement Forum, AI Family Forum, Women in Da'awa, Path to Paradise, among others. In this forum, she has presented papers in the areas of exemplary family life, teenage psychology and development, career choices, leadership skills, youth leadership skills, youth brain health and management, mental health that include sleeping disorders, depression, anxiety disorders, drug abuse, diet and nutrition, home management, among others. In her bid to improve family life and development, she has translated and published a resourceful book in Hausa that is called Muslima Tagari. From the English version of the book, The Ideal Muslimah, which has gained global accolade and acceptance by Muslim Hausa communities. She is happily married to Dr. Farooq Umar Usman, a retired permanent secretary and a former DG of Abubakar Rimi Television ARTB, who is retired but not tired. They are blessed with 6 children and 11 grandchildren. Mr. Chairman, sir, ladies and gentlemen, I present to you Professor Hassana Sani Darma, the 61st anniversary, the 61st inaugural lecture of Behavioural University, Kano. Thank you very much.
Thank you, Dean, Faculty of Education, Professor Abubakar Ibrahim Hassan. Can we please put our hands together for me? Before we invite the speaker, I have the honor to acknowledge the presence of the former Vice Chancellor Aliko Dangote University of Science and Technology, Wudil, Professor Shehu Alhaji. You are welcome, sir. We also have a former ASU National President and a one-time Deputy Vice Chancellor of Research and Development of this university, Professor Comrade Abdullah Yusuf Khan. You are welcome, sir. We also have a former National President of ASU, Comrade Professor Nasiru Isa Fagir. Also, the current UK chapter ASU chairperson, Comrade Professor Ibrahim Tajo Suraj, as well as former Nigeria's ambassador in Brazil, His Excellency Professor Ahmad Muhammad Makardi, and the former Nigeria's ambassador to Romania, Her Excellency Dr. Sepia Ahmad Noor, as well as the Vice Chancellor, former Registrar of National Examinations Council, NECO, and Vice Chancellor Khalifa Isa Farad University, Kano, Cairo, Professor Abdul, and all other invited. You are all recognized and are welcome. At this juncture, I have the honor to invite the Amazon, Professor Hassana Sani Darma, to present the first Professorial Inaugural Lecture titled Rejigging Cognitive, Behavioral and Coordination Functions, Nutrient Supplementation for Neurodivergent Disorders. So, you have 40 minutes to present your lecture.
I'll try to do that. It's in a recording? Assalamu alaikum wa rahmatullahi wa barakatuhu. Alhamdulillah wa salatu wa salamu ala rasulillah. Rabbi shrah li sadri wa yassir li amri wa ala al-uqdatan min lisani yafqahu qawli. The Vice Chancellor, Sir Professor Haruna Musa, ably represented by the Deputy Vice Chancellor, Research and Development, Professor Amina Mustafa, the Bursar, the Registrar, the University Librarian, all provosts here present, all deans and directors, former Vice Chancellors here present, Vice Chancellors of other universities here present, my colleagues, my students, family members, friends and well-wishers, Assalamu alaikum wa rahmatullah once again. Today I'm here to present the 61st Professorial Inaugural Lecture, and it concerns with the fact that I'm also going to be 61 this year, inshallah. My title, it is with a deep sense of humility and a strong commitment to academic duty that I speak to you today on the occasion of my inaugural lecture titled Rejigging cognitive, behavioral, and coordination functions, nutrient supplementation for neurodivergent disorders. This presentation marks not only a personal academic milestone, but also the outcome of years spent investigating special education, neurodevelopment, and nutritional science within Nigeria's unique educational landscape. We're going to be following this simple outline: the introduction, my personal academic pathway, special education needs, our body's main control hub, nutritional supplementation, management of special needs conditions. We'll discuss a few case studies, and then I will now discuss some of my scholarly contributions and the impact and legacy I will finally leave behind by the time I retire, inshallah, and then conclusion. My scholarly path has been guided by a sustained focus on marginalized learners, especially those with learning difficulties, autism, and behavioral challenges in under-resourced communities across Nigeria. My initial training was in special education, and all my early work concentrated on only 3 core areas. That is recognizing, assessing, and diagnosing learning disabilities, enhancing teacher readiness for inclusive classrooms through the provision of intervention strategies and treatment options for special needs learners, as well as educating parents on children's potentials and guiding them on proper support and management. But as my experience grew, so did the scope of my research. And then it branched into assessing, diagnosing, and treating learning, emotional, behavioral, and coordination disorders, amplifying the role of parents as advocates for children with neurodivergent disorders, and then developing nutritional support strategies for children with learning, behavioral, and coordination disorders. Despite efforts at both public and private schools in providing educational support, many students with neurodivergent disorders continue to show minimal improvement. This persistent challenge prompted a fundamental shift in perspective, one that led me to examine the underlying biological and nutritional factors influencing cognition and behavior. Consequently, my academic focus broadened into an interdisciplinary approach, combining education, special education, neuroscience, as well as nutrition. Today's lecture reflects this transformation, a synthesis of insights gathered over 25 years of inquiry at the intersection of these fields. Maybe people will ask, how did I go into nutrition? Well, in secondary school, I did foods and nutrition, and during my diploma, I also did food and nutrition. So I have a lot of background in nutrition. Now, let's go a bit into what special education needs and conditions are. Most cases, as soon as somebody says you are in special education, you'll be asked whether you know how to sign or whether you know how to braille. Because a lot of people assume that special education only consists of deafness, blindness, and crippledness, people in wheelchairs. Anytime you talk about special education, that is the thoughts that people think about. Now, I want us to be clear today that special education has so many other areas. There's the area that deals with intelligence, cognition, and learning. And in this area, we deal with students who are highly gifted or highly talented, that is on the higher aspect of intelligence and cognition. And then we have those at the lower end who have struggles with learning and retention and so on. And those ones are the ones that are called learning disabilities and individual and intellectual disabilities. Then we have people that have communication and interaction needs. They have problems with speech, they have problems with articulation, they can stammer, they stutter. Sometimes they have a lot of problems understanding language, the normal language that people speak within them. That means they have problems comprehending and decoding what is said to them. And that category is a different category. And then the ones that we are used to, the sensory needs, those who have totally, maybe those who are totally blind or totally deaf or hard of hearing or have low vision and so on. And then we have the emotional, behavioral, and social needs. Those are the ones who have problems controlling their emotions as well as problems controlling their behavior. And then the physical and health needs. Those are the ones that have musculoskeletal problems, and they could have other health challenges like sickle cell anemia, juvenile diabetes, juvenile arthritis, and so on and so forth. And there are times where some people are unfortunate to have multiple disabilities, having either blind, deafness, crippled, and so on and so forth. So I think with this now, when you tell your children to come and apply for special education, they shouldn't be afraid, because it's not just about blindness and deafness. Globally, neurodevelopmental disorders affect 10 to 15% of children, making them the most common childhood disabilities. The impact is more pronounced in LMICs, where poverty, malnutrition, infectious diseases, and limited access to early support services heighten developmental risks. These conditions carry significant consequences, not only for individuals' health and well-being, but also for educational systems, healthcare capacity, and national economic productivity. In Nigeria, the landscape is particularly challenging and poorly documented. Existing data suggests that special needs conditions are usually underdiagnosed, largely due to insufficient screening, lack of reliable prevalence studies, and weak systems for identifying disabilities. Access to diagnosis and support services is severely constrained, especially in rural areas, where there is a critical shortage of specialists, such as clinical psychologists, special therapists, as well as occupational therapists. To address this issue, the federal government, under the Ministry of Education, inaugurated a committee to advance occupational, audiology, and speech therapy education with a promise of 500 million in annual funding. The minister, Dr. Tunja Alausa, said this was to close critical gaps in specialized healthcare training and specialized services. The committee will work with universities to first of all develop curricula, establish regulatory standards, offer courses in these specialized areas, as well as collaborate with key agencies including NUC and TEDFund to ensure quality and sustainability. Now, what is the body's main control hub? Coming back to my topic. Human function is the result of a complex interconnected biological network involving the central nervous system, the musculoskeletal system, as well as the peripheral nerves. They govern cognitive functions, emotional responses, sensory processing, and both voluntary and involuntary actions. They do not work independently, but instead operate in coordination to support thinking, behavior, movement, and adaptation to environmental demands. Their combined effectiveness is significantly shaped by nutritional factors. Nutritional factors, malnutrition, overnutrition, undernutrition, especially during these key stages of growth and development. Now, what is the role of micronutrients? Because they are the ones that are going to serve as the nutrients that we need. Micronutrients, as the name implies, play a critical role, serving as essential components in biochemical reactions necessary for brain development and function. Though they are needed in minute amounts in the body, but without them, there could be problems. Iron, zinc, iodine, and vitamin B12 stand out due to their specific contributions. Their importance is most evident during the first 1,000 days of life. The first 1,000 days of life is from conception through the age of 2, a period widely recognized as a crucial phase for brain development. No wonder, even in the Quran, we are asked to breastfeed our children up to 2 years. Can you imagine this? And then science is just now discovering. During this time, the brain undergoes rapid structural growth and specialization. Neural circuits begin forming and become more refined. Synaptic connections develop and strengthen. What is neurodivergence? It describes natural differences in how brains are structured and how they function, different from what has traditionally been seen as typical neurological development. It includes a range of neurodevelopmental conditions such as autism spectrum disorder, attention deficit hyperactivity disorder, dyslexia, dysgraphia, dyspraxia, and related profiles. Rather than being interpreted exclusively as medical impairments or disabilities, these variations are increasingly recognized as integral parts of human cognitive diversity. What is neurodiversity? The idea of neurodiversity, first introduced by Singer in 1999 and expanded in current research, marks a shift in how such neurological differences are understood. This framework moves away from deficit-focused views, framing neurological variation as a normal, expected, and valuable aspect of human life. So if you have children that have shifted from the norm, that does not make them completely useless. It means they are learning and developing at a different phase. Neurodivergent individuals often demonstrate distinct cognitive strengths, such as heightened creativity, pattern recognition, or innovative problem solving that can thrive in well-supported environments. This strengths-based approach has influenced both education and clinical practice, encouraging more inclusive strategies tailored to diverse learning needs. There are two key principles of neurodiversity. First of all, recognizing neurological differences as a natural part of human variation. Secondly, building inclusive educational systems that acknowledge and support diverse learners. While the neurodiversity movement rightly advocates for acceptance and inclusion, it must also be balanced with effective, science-based, multidisciplinary support. Viewing nutrition as a key factor in brain health opens new pathways to improve cognitive, behavioral, and adaptive functioning, enhancing both understanding and real-world support for neurodivergent communities. Now, what are cognitive functions? As I mentioned in my title. Cognitive functioning involves a range of mental processes that allow individuals to learn, allows individuals to process information, and allows them to solve problems and adapt to their surroundings. These functions rely on complex neural networks in the brain and are central to learning, behavior, and overall development. Information processing, memory systems, executive control are all vital for academic achievement and daily functioning. What are behavioral functions? These encompasses observable ways individuals act, respond emotionally, and interact socially within their surroundings. These patterns are not random, but they emerge from ongoing, intricate interactions between biological systems, such as neurotransmitters and hormones, and environmental factors. Current research in neuroscience and developmental psychology highlights that behavior is grounded in biological mechanisms, especially brain chemistry and neural networks, while also being continuously influenced by life experiences and social context. Now, coming to coordination functions. Motor coordination is the capacity to carry out smooth, precise, intentional movements by integrating the nervous system, musculoskeletal system, and sensory inputs. They have these three areas: sensory integration, muscle control, and neural signaling. Now, what are food nutrients? When we were in primary and secondary school, we were taught about all these classes of food. And we all know that carbohydrates are for energy, proteins for growth, fats for energy, vitamins and minerals for health and well-being. But for this case today, we are talking about the brain. So carbohydrates fuel brain activity, proteins are precursors for brain chemicals, fats are essential for brain structure and function, while vitamins and minerals are key regulators of brain and body functions. And I want us to remember that there's also water and fiber. What is nutritional supplementation? It involves delivering specific nutrients through either tablet form, syrups, or fortified foods or dietary modifications to address nutrient shortfalls and support optimal bodily function. We want to thank Director CDA for all the 45 seeds that are being managed and given to farmers so that we get the right type of nutrition in our societies. In the context of neurodevelopmental and overall human performance, it has become an important strategy for improving cognitive, behavioral, and motor skills, especially in at-risk groups such as children with neurodevelopmental differences. Targeted nutrient interventions can help restore brain chemistry, it can help restore and improve neural efficiency, and can also lead to better developmental results. Now, what are the core principles of nutritional supplementation? We target nutrient provision so that you can correct all the deficiencies. Now, from the time I finished my PhD and the time I became HOD and opened the assessment and diagnostic unit in the department, we have done a lot of assessment and diagnosis. And I use an all-encompassing assessment for capturing, first of all, the biodata, history assessment checklist of the client that comes. You need to know where the child belongs. You have to identify the weaknesses, his strengths, his weaknesses, and then what he needs. And then this assessment checklist has places for scoring criteria and even placement options. Are you going to place the child on nutrition, or are you going to just place them on other educational or therapies that they need to become better? The assessment checklist comes in a Likert scale from the form determining increase in level of severity from mild, moderate to severe. Children are diagnosed based on the areas of skills they have less abilities in and the level of severity in each category of skills. And before embarking upon any nutrient supplementation, we usually determine nutrient status in the client. Nutrients that are found to be deficient are thereby prescribed and used for treatment. Now, apart from that form that we use for identification, now we go a little further to now collect the nutrient status of the clients. And one of the machines we use is the atomic absorption spectrophotometer. It is a standardized instrument used in quantitative determination of nutrients or chemical elements through the absorption of optical radiation of free atoms in the gaseous state. It allows the measurement of extremely small amounts of elements and is routinely used in medicine, manufacturing, mining, environmental monitoring, and laboratories throughout the world. This picture here is the old version, and my initial tests were carried out in the Central Lab BUK by Malam Musa Bedi. Are you here, Malam Musa? You need to stand up for recognition because we did this as far back as 2011. And then later on, we found the machine again in the Department of Soil Science, Faculty of Agriculture, and then we carried those urine samples for them to help us get the status. This is the new type of the atomic absorption spectrophotometer. And elements assessed include, okay, we can use blood, plasma, urine, saliva, brain tissue, liver, hair, muscle tissue, semen, and water for assessment. And the elements assessed include iron, potassium, magnesium, manganese, selenium, iron, sodium, copper, zinc, cadmium, and peptide. For assessment, we usually use the early morning urine sample so that we can get maximum results. And then the quantum magnetic resonance body analyzer was also discovered, and it is a standardized digital instrument with an input calibrator. The instrument rapidly determines the health status of an individual by measuring the energy emitted by the body cells during division and multiplication in energy photon. It diagnoses dysfunctions in several body systems like the heart, brain, kidney, lungs, gastrointestinal systems, reproductive organs, and so on and so forth. But for my own treatment, we only use the results from trace elements, vitamins, amino acids, and coenzyme results are used to determine need for supplementation. Now let's look at some few empirical evidences on why nutritional supplementation is needed and of marked importance. Omega-3 fatty acids, and attention. They are vital for maintaining neuron membrane structure and supporting synaptic activity. In one of the researches I conducted in 2011, a quasi-experimental research, and the topic was efficacy of omega-3 on handwriting skills of people with ADHD. And people kept asking me, what is the connection between omega-3 and handwriting? And I said, no, it is not the handwriting we are looking at. We are first of all looking at the behavior. If the omega-3 helps us improve attention and concentration, then that attention and concentration and focus will now manifest in the handwriting, because there will be reduction in hyperactivity, impulsivity, distractibility, and then automatically you now see handwriting improving. Now, to support that, randomized trials by other people show that supplementing with omega-3s can enhance attention, executive function, and behavioral control, particularly in children with ADHD. While results vary, meta-analysis indicates small but meaningful improvements in attention and hyperactivity, underscoring the role of these fats in brain signaling and cognition. Now, the second one is iron supplementation and cognitive function. Iron is essential for brain development because it influences oxygen transportation from the blood to the brain, and so cellular energy production and dopamine synthesis. Deficiency in early childhood is consistently linked to delayed cognitive development, reduced focus, and lower academic achievement. Can you imagine? Just low level of iron can make your child not perform well academically in class. Iron supplementation improves cognitive performance, especially in those with anemia. Now, zinc supplementation and behavioral regulation. It supports synaptic transmission, neurotransmitter function, and immune health. Low zinc levels have been associated with behavioral issues such as impulsivity, hyperactivity, and emotional dysregulation. Zinc supplementation can reduce the symptoms, particularly in children with ADHD, and it plays a vital role in regulating dopamine metabolism, which affects attention and self-control. Now, what is the Nigerian perspective in respect of nutritional supplementation? We have high rates of micronutrient deficiencies among children, and national data reveal widespread shortages in iron, vitamin A, and zinc, which contributes to poor developmental and educational outcomes. And then the school-based programs and community nutrition initiatives have shown potential in improving health and learning. However, obstacles are always abound. Limited availability of supplements, low public awareness, and weak enforcement of nutritional policies. And overcoming these barriers requires embedding supplementation within broader public health and education systems, particularly in inclusive learning environments. Now let's look at a few case studies in Nigeria. The first was mine, where I looked at 2 primary schools, primary 5 students, aged 10 to 12, that had ADHD symptoms and handwriting deficit, and we gave them omega-3 for 12 weeks, and the outcome became improved attention, concentration, and focus, reduced hyperactivity, reduced impulsivity, and improved handwriting skills. The results underscore the potential of omega-3 supplement as a complementary intervention in managing ADHD, as well as handwriting disorders. While not a substitute for behavioral therapies, dietary strategies can significantly enhance functional outcomes, particularly in low-resource settings. It was while I was doing this study that I remembered that we took omega-3 supplement, cod liver oil, as a child every day in the morning before going to school. And I don't know why my father insisted on that, but now I understand why. It wasn't a nice experience. School feeding program. Now, the National Homegrown School Feeding Program also is designed to provide nutritional meals to primary school pupils. Findings showed that there was significant improvements in school attendance and enrollment, classroom engagement and participation, cognitive performance and learning outcomes. And the conclusion is that nutritional support within educational settings directly enhances cognitive functioning and academic performance by alleviating short-term hunger and improving nutrient intake. School feeding programs create a more conducive environment for learning. Autism and dietary intervention. Empirical findings showed that there was omega-3 supplementation too, and then there was a reduction in processed food intake. This is something that all of us should look at. Nowadays, all our grandchildren go to school with already processed foods, biscuits, chocolates, carbonated drinks, or drinks in cans. All of these are processed foods, and they can increase hyperactivity in children. So when you reduce all those, there will be reduced hyperactivity, improved social interaction, and decreased repetitive behaviors. The last one was rural malnutrition and academic outcomes. Intervention studies focused on iron supplementation, and the children were given iron supplementation for 12 weeks, and it showed significant gains in literacy and numeracy scores compared to a control group. What are biochemical imbalances? When molecules inside neurons shift out of sync, it changes how signals move across the brain. And then when you give food, the right type of nutrition, then there will be increased awareness among when nutrition is poor, brain development is tied to body chemistry gets ignored too often, leading to behavioral issues and learning strategies. So feeding with better food could help fix some health and school troubles. Hence, making it work means increased awareness among educators and healthcare professionals, improved access to nutrition, nutrient-rich foods and supplements, then policy-level commitment to nutrition-sensitive interventions. Now, some of my scholarly contributions, some of the studies I have taken personally was the ADHD one that I've already discussed, the prevalence, and I found out that among the two schools, the classes were like 75 to 78, and in each of the classes we could find up to 10 to 12 children that had ADHD. And then in a survey where I wanted to find out whether poor handwriting, which is dysgraphia, is a symptom of attention deficit hyperactivity disorder, we found that out of 64 people with ADHD that were tested for handwriting difficulties, 66% exhibited symptoms of dysgraphia, and the others did not. And out of the 40 with dysgraphia, 25 were males, while 15 were females, giving us a ratio of 5 to 3. And then, because I'm in the emotional and behavioral area, I went to remand home and did another study. At that time, the inmates were only 81, and 75 were convicted for theft, stealing, and criminal conspiracy, 17% for rape, and 8% for involuntary manslaughter, which is called accidental killing. And when we looked at their economic status, 75% came from lower class, 25% from middle class, and none from the upper class. Out of the juveniles, 3% were in school, while 17 were out of school system. Finally, when we looked at their birth history, 92 were delivered without any complication, so we couldn't link their birth history with their behavior, and 8% with birth-related or postnatal complications. Now, then efficacy of omega-3, I've already discussed that, and we know that it is very, very significant in ameliorating behaviors and improving learning outcomes. Now, in the clinic, in the special education clinic, I looked at the highest number of clients that attended there, and they were those with ADHD. And so we looked at 76 of them were males. The age distribution was between 2 to 5, 18%. And then regarding the correlation between health background and occurrence of ADHD among the clients, 15% were victims of pre, post, and neonatal complications, as well as other health and traumatizing issues. The findings revealed that a higher number of males with ADHD and 41% were mainly hyperactive and impulsive. Now, my personal impact and legacy. In 2011, I founded a consultancy called Learning Disabilities and Education Consult. And over the years, I've seen a lot of clients, but I picked out only 10 years, 2016 to 2025. And we picked out 400 clients. We sampled 356 files, and the cases had a diverse range of disorders from different backgrounds, location, and ages. Selection criteria was 0 to 21 years, and any client that presented with BP, diabetes, sickle cell anemia, skin diseases, liver, kidney, etc. were referred to hospital for proper medical attention. And the selected sample was analyzed based on age, gender, position of the child in the family, category of disability, period of exposure to risk factor, and probable risk factors. The results of these 10 years shows distribution of clients based on gender. You can clearly see how many males there are and how many females there are. There is no partiality, and you can see that the males usually have higher results. Distribution of clients by age, 52% were 3 to 10 years. Category of the disorders as diagnosed: ADHD, autism, emotional behavioral disorders, learning disabilities, intellectual disabilities, speech disorders, Down syndrome, cerebral palsy, depression, physical and health, and so on. You can see that learning disabilities had the higher categories that came, followed by intellectual disabilities. And then the probability period of exposure to risk factors.